Okay, I'd like now to introduce Dr. Andrew Goodall. Andrew regularly speaks at our conference, and we thank him for his contribution. Andrew is the Director General of Health and Social Services and the Chief Executive of the NHS Wales, where he's been appointed since June 2014. Andrew's worked in the NHS for 25 years and has particular interests in improving patient safety, quality and patient experience, partnership working across public services, which I think must challenge you and us all, and delivering frontline services through service improvement. So we'd like to welcome Andrew to the stage. Thank you.
Good morning. Very nice to see you all, and just to thank you once again for the opportunity to attend to speak to you all this morning. As I've said previously in this forum before, I do take seriously that alongside the NHS Wales Chief Executive role, my Director General job description does cover both health and social care, and of course that does rely on very strong professional support from Albert Heaney and his team within Welsh Government. So Neil, thank you very much for the opportunity to speak to you all again, this time at the start of your 2016 conference. So some reflections from me, just I hope to frame your 2 days together and all of the learning that you're going to be doing. This has been a really busy time for social services and its future across Wales, certainly reflecting back on my 2 years in post, not least the mechanics and the impact of new legislation and what that should mean for improving the support we give to people in our communities. When I spoke last, I focused on the prudent health and care agenda, recognising that I felt it had a really strong resonance with a citizen-focused co-development agenda that's been driven by the Social Services and the Wellbeing Act. Primary care lies at the heart of how we're going to make prudent healthcare happen, with a focus on the development of alternative pathways for patients, and the shifting of resources towards multidisciplinary primary and community care teams will occur. And inevitably, this is going to require working closely with social care to meet people's needs at or close to home, and I think is still very much complementary to the drive to embed services in communities under the 2014 Act. Over and above this, there is our broader Welsh approach to wellbeing, which is framed by the Wellbeing of Future Generations Act, and I think complemented by our visions for prudent healthcare and sustainable social services. All seek to make organisations work better together, focusing on longer-term outcomes, and all of these factors and common themes point towards a unity of purpose between the health and social care systems in Wales. Whilst it, of course, will fall to our new ministers to set their expectations for the next 5 to 10 years, and it's going to be directed by a new programme for government, I'm confident that they will want to see joined up working to this end, and that this should deepen as the Assembly term progresses. And in our best examples across Wales, this has been a philosophy already embraced by local schemes and partnerships, and using enabling funding, for example, such as the intermediate care funds over the last couple of years. Earlier this year, in February, NHS Wales and Welsh Government jointly published a document called Prudent Healthcare, Securing Health and Wellbeing for Future Generations. And the purpose of this was to focus our collective efforts on 3 national actions, whilst recognising the vital importance of 3 essential enablers to make those actions happen. And that means the public, the workforce, and from those of you in the room and others outside, effective public service leadership. And I wanted to focus for a minute on one of the national actions which is most relevant to all of us here today, namely the action to improve working together to improve healthcare. Look, I believe that social services are leading the way in this respect. Look at the examples of the Llanelli multidisciplinary team or the service redesign work in Monmouthshire, to just quote 2 examples. But we need to do more on a larger scale and at pace. Both the Wellbeing of Future Generations Act and Social Services and Wellbeing Act provide the platform for us to deliver better outcomes for our population in Wales. And it's clear to me that the NHS can't do this alone. To do this, the NHS must work in partnership with other public sector organisations, the third sector, the independent sector, and industry. Through the principle of co-production, prudent healthcare requires organisations to concentrate on what matters most to individuals. To create and achieve patient-centred care will require meaningful integration with boundaries within and between organisations becoming seamless. And I think we need to recognise that we're going to have to ensure that the experience works seamlessly across our respective settings and sectors. And that means from home services to care homes, from our community settings to our specialist hospitals. And I think we're going to need to reflect on what integrated recruitment means and working together on our workforce for the future. And of course, I would state, obviously in the context of new relationships that we need within Europe and in the international context. When I was last here last June, the Social Services and Wellbeing Act was still on the statute book, and work to implement it was still being taken forward in earnest. But we're now beyond the date of implementation, beyond that date, but at the start of a continuing journey on the path to integration. And on this occasion, I would like therefore to focus on the theme of cooperation and partnership, which is such a powerful one that runs through the Act. No one should be under any illusion that the Act and a new way of working under it will demand far-reaching change in the health and social care sectors and how they interact, change that can only be achieved through working in partnership. This is not just about structures, it is about collective behaviour and leadership. It's not about technical compliance with the law, but rather looking to the collective good of the Welsh population. Look, it's Wimbledon week, and I was driving up last night and actually listening to John McEnroe and Tim Henman. Their reflection on the British game was that we needed to have an evolution in the game, but there needed to be a revolution in the culture around it. Now, I still think that we can offer many innovative services around the way in which we want social care and health to work together. But ultimately, we've put lots of enabling structures and mechanics in place, and I think it's still about our attitude and behaviour to take full advantage of these, which is the really important component of our focus from today onwards. This cooperation and partnership will be a major theme for this Assembly term, and for this reason, I'll be looking to all participants to make the best possible use of the substantial tools for partnership and cooperation provided for them by the 2014 Act. I was pleased to hear the positive feedback from the Regional Partnership Board's learning event organised by Welsh Government last month, and I know participants welcomed the chance to share the opportunities and the challenges facing these boards with colleagues from across Wales. This type of learning activity is vital if we're to drive up the quality of partnership working in all of the regions of Wales. As the Welsh Government, we are committed to partnership and joint working, which improve the personal outcomes for and promotes the well-being of all people. We understand that services are better, both more effective and more efficient, if we work together. We need only to turn to the Intermediate Care Fund and its legacy of successful delivery through joint working on areas as diverse as preventative and reablement solutions, single points of access, housing and telecare improvements, rapid response teams, dementia care, and 7-day social work support for evidence of this. And in the regional partnership boards co-designed with you, we've given you the formal structure for this partnership working. And in the provision around pooled funds and shared budgets, you have real levers for change. Underpinning all of this is the formal duty to cooperate, of course, biting on all relevant partners, and the assessment and planning requirements, which will uncover and synthesize the key information to drive your decision-making and your delivery. Clearly, efficiently organising your regional partnership boards are going to be a major priority. They will be the vehicle to drive integration, and you have a responsibility to ensure they lead to effective services to promote the well-being of people with care and support needs. Your previous experience of working regionally, including through the non-statutory arrangements that were established around the implementation of the Act, I hope are going to be of some assistance to you in this, as will your commitment for shared learning, as evidenced by last month's event. My own view is it's going to be essential for boards to fully utilise the clear evidence base of care and support needs provided by your population assessment reports. And in anticipation of the first population assessment that will take place in April 2017, the work of building capacity, making evidence gathering and analysis arrangements, and preparing to make operational the output of these will have to be taken forward as a priority. In our statutory guidance on partnership working, we set out a number of priority areas for joint working, and these were older people with complex needs, people with learning disabilities, carers, and children with complex needs due to disability or illness. Integrated family support services also remain a priority area and now fit into this wider framework of integrated service provision. We've learned much from IFFS, and we in the Welsh Government will be looking for progress in rolling out the integrated aspects of the service more widely to these priority areas. And now is your opportunity to consider how this model can successfully be applied to other areas of the Regional Partnership Board's business. There is a lot of attention elsewhere in the UK on integrated services and regional structures, and I would argue that in Wales we've been well placed for this, and more so now with the recent legislation. I believe, given the inherent partnership approach of our Welsh structures and the way in which our communities engage with us, that we have the opportunity to be pioneering in the experience of how public services work together. It's also, for me, been a feature of recent senior appointments across the NHS and within my own team at Welsh Government. For example, the recent Chief Medical Officer post, that the structures and the public service principles we offer in Wales have been attractive to interested individuals. So I think that we need to promote and celebrate these more, but also ensure we deliver more and better as a result of these structures. The pooling of budgets also presents a major opportunity, as well as making operational these pool budgets in practice, which are immediately required of you. You will need to be looking forward and planning ahead to the requirement for pool budgets for care home accommodation functions that will come into effect in April 2018. I would hope that this will allow for the careful development of an integrated approach to commissioning care home services. The NHS works in the context of a broader care system, and I've expressed in other settings the need for very close work on care home sector resilience for the future. Progress in all of these areas is important. However, I also encourage you not to wait for strategic direction from Welsh Government for further progress down the road to implementation, but to make regional collaboration and pool budgeting agenda your own through exploration of the potential to roll this out regionally and even more widely. From my perspective, a poor outcome in 2018 will be the need for ministers to direct, because it will mean that organisations and services have not come to a conclusion to work, align and pool budgets together. The Intermediate Care Fund has been a key driver in relation to partnership working and collaboration. And the initial focus has been on frail and elderly people. Here, by funding and operating intermediate care services, we're helping to support older people to maintain their independence and remain in their own homes. And clearly this is consistent with the Welsh Government's commitment to independent living through supporting a greater range of care and support services provided within community settings. However, it can also help prevent unnecessary hospital admissions, and through this help reduce the incidence of delayed discharges, thus providing an excellent illustration of the benefits of this type of constructive collaboration. To take another example, and building on that last point, we must all acutely be aware of the impact of delayed transfers of care, both on the ability of the NHS to effectively manage care services, and perhaps more importantly, directly on the individual whose well-being and independence is threatened by their continued stay in a hospital bed. And of course, these arrangements need to be facilitated by health and social care in terms of creating those appropriate settings and environments. And projects developed through the Intermediate Care Fund have demonstrated that reductions can be made in the number and the duration of delayed transfers of care when health boards, local authorities and their third sector partners work together to improve the planning and timely completion of the process to discharge patients to the next stage of their care. And now the scope of the Intermediate Care Fund has been extended for 2016-17 to include people with learning disabilities and complex needs and autism. And I hope to see that all parties to the ICF can make best use of this opportunity. In promoting the regional partnership agenda, we're not seeking to suggest that there is no place for collaboration at national level. The development of an integrated autism service funded by the Intermediate Care Fund is an example of an area for this, following the path trodden by our successful National Adoption Service. The collaborative working led by the Association of Directors of Social Services Cymru on implementation of the Social Services and Wellbeing Act is another. And we all acknowledge how important the workforce will be to the delivery of a new way of working collaboratively. Indeed, I was reflecting on this with NHS workforce leads only recently, challenging them to look afresh at workforce developments and new roles in the context of integration of services. On the social care side, I expect that national support for this will be provided by Social Care Wales, the new lead body for workforce regulation and service improvement. And finally, the national tier will be completed by a refreshed National Partnership Board, to which the regional boards will relate, and which will provide Welsh Government with an invaluable development partner and advisor on further social care reforms. So I hope that helps to just frame some initial reflections. I acknowledge the workload, the busyness of the day-to-day job, as well as what's wanting to seek what can be better for the Welsh population and community. Thank you once again, Neil, for the opportunity to address you all at the start of what promises to be an interesting and challenging new Assembly term. I wish you well for the rest of the conference as you grapple with the opportunities and challenges before us, and I also accept my own responsibility with Welsh Government to work with you on all relationships with the NHS and help to facilitate these national opportunities. So I look forward to continuing to work with you all. Thank you very much for listening. Diolch am wrando. Thank you.